One of the trickle-down effects of those surging numbers, skyrocketing wait times in hospital emergency rooms. They're being measured in hours, not minutes in many cases. Our Tim McNicholas introduces us to one suburban family who learned that the hard way.
My uncle is 83 years old, and my 79-year-old dad brought him to the emergency room.
Maura Dunleavy wrote us about a long wait for her Uncle Edward at the Palos Hospital ER. She wants everyone to know about what it's like in an emergency room these days.
I said, "Are you telling me to leave?" And they said, yes. So I left. But I left my brother there alone, and I didn't feel very good about it.
Brian Dunleavy brought his brother to the hospital for a non-COVID related issue. He believes seniors should be allowed someone at their side.
Old people and babies should have an advocate. And that's what made me mad.
The other thing that made Brian mad, the wait time for his brother. After some testing, Edward waited 17 hours for treatment in the ER, according to his family.
Nobody asked him if he was hungry, nothing. He slept in a wheelchair, and he scrounged up from someone some potato chips.
Emergency rooms are overwhelmed.
Palos Hospital told us to speak with Dr. Michael Bauer, who is the medical director at Lake Forest Hospital. It's in the same Northwestern Medicine network as the Palos Hospital. He has not seen 17-hour waits at his hospital, but he acknowledges wait times are high these days.
2, 3, 4, sometimes even 5 hours.
But Dr. Bauer says there's something we can all do to help. Don't go to the ER if it's not truly an emergency. He offered this plea.
Can't stress enough, please be aware emergency rooms are not for COVID testing.
Back to Edward, Dr. Bauer explains why his brother could not wait with him in the ER.
A lot of the times, unfortunately, we have to resort to not having anybody that's unnecessary to be there waiting around.
I'm not knocking Palos Hospital. I've had great care from them and the family over 40 years, but something ought to be done. And particularly, they ought to do something about old people.
Tim McNicholas, CBS 2 News.
Dr. Bauer tells us that patients are prioritized based on their condition, so anyone in the ER with a true life and death emergency will not experience a long wait.